Welcome to the launch of Northumbria University BSc Nursing in partnership with Kaplan Singapore. This is a 24-month programme that's being delivered as CPD for qualified nurses who have a practising certificate within Singapore. It comprises of 8 modules which will be delivered over the 24-month period. Each semester you will complete 2 modules, and each pair of modules have been carefully crafted to make sure that they scaffold your learning and help support you to develop as a senior practitioner. The first pair of modules is research for nursing. This is combined with innovations in healthcare. Research underpins everything we do in nursing, and it's important that all nurses have a good understanding of how we develop and scaffold our practice to make sure that our patients get the best outcomes. Innovation becomes really important because innovation needs to be based on research. We have to have sound evidence for what we do. However, we also need to encourage our leaders of the future to take decisions and innovate and develop practice. This module will help people to think about what can they do in their own environments. It will also look at technology and how we can use it in healthcare to become innovative and more cost effective. The second pair of modules is teaching and learning and health promotion. Teaching and learning is an essential skill for all nurses. We all have to continue with lifelong learning. We also have to be able to teach. We have to be able to teach each other. We have to be able to teach our patients and teach families. These are skills which you'll use both in practice and for those of you that might then go on to develop teaching skills. Health promotion sits alongside this because a big role of health promotion is educating the wider public. This has been identified in the Healthier SG programme that's been launched by the MOH. It will form an essential part of preventative health, which is a major aim with the ageing population in Singapore. As you move into second year, you'll cover healthcare ethics and law and nursing the older person with complex needs. Healthcare ethics and law is a very complex area, and it is becoming more so. As the challenges of cost effectiveness and the development of high tech, we have to make some very difficult decisions around patient care. We also have to balance that with what the patient wants and what their family wants. And this can present massive challenges, particularly if this challenges our own values and beliefs. There are also changes in law which have happened recently, which may then consequently impact on that. One of the big challenges for Singapore is allowing the patient more autonomy and looking at capacity and consent. This feeds nicely into our older persons module. Ageism is a problem globally, not just in Singapore, and we will really challenge students' beliefs around what does it mean to get old and what does it mean to age well. We'll look at chronic conditions and how they affect the older person, and we'll also look at multimorbidity, where there are 2 or more illnesses in existence with each other. This can increase frailty, and frailty increases the likelihood that a person will need to be hospitalised or use secondary or tertiary services. This obviously has a massive impact. With the launch of the Healthier SG, we're now looking at things such as social prescribing and much more community support and other options so that healthcare and health support will not always be delivered through health services. This module will help to look at the aged and the more elderly population and how we can support them through independence and autonomy. The final pair of modules are health assessment and leading and developing. Health assessment is an innovative module. We will be helping students to take histories and then go on to make higher level decisions around that nursing assessment. This is a key skill for those of you wanting to go on and lead and develop in Singapore's developing healthcare industry. There will be an OSCE examination, which will be done in real time, which will be examined by the module team. And there will be a range of other strategies used. This goes on and we finish the course with leading and developing, which helps to support you in order to lead and develop in your own practice area. This could be at a ward level or it could be at a high level within the hospital. Across the programme, we use a range of delivery methods. Some of them might be quite new to Singapore, some of them are well established. So we will be delivering asynchronous teaching, which is teaching that is available to you 24/7 online, which you're able to access whenever you like. That's really important in today's busy healthcare environment where you're trying to get that work-life balance. There will be some online synchronous teaching where faculty in the UK will come on this and will be delivered at 7 p.m. Singapore time, so you have time to get home from work and then you're able to engage with your studies. There will also be a face-to-face in-country block for each module where you get to meet the staff. The teaching in country will be focused around debate and negotiation and how to develop those skills around the core topics of the modules. There will be workshops and seminars delivered in country. Once the flying faculty have gone home, these will be followed up with further seminars that will be done synchronously, as well as tutorials to support your assessment. Assessments across the programme are done in a range of styles, from exams, written assignments, and poster presentations and video presentations. It's important that we use a range of assessments to enable all students to achieve the highest marks. We look forward to seeing you on the programme.